Erectile dysfunction is a big taboo among men, and many are ashamed of looking for medical help. However, loss of erectile ability may be a warning sign that there is something wrong in the body that should be sorted out by a doctor. My name is Stefan Buntrock. I'm a board-certified urologist and sexologist. On UroChannel, you will receive first-hand information on urological diseases and sexological conditions every Wednesday and Saturday. So please subscribe to never miss out again. Sexual function is fragile and prone to interference by a number of completely unrelated diseases. A classic one is myocardial infarction due to atherosclerosis. The penile arteries are the smallest in the body with a diameter of only 1 millimeter. The coronary arteries are 2.5 millimeters in diameter. As you might know, a heart attack is the result of a blocked coronary artery. This means that erectile dysfunction may be a warning sign of an imminent heart attack in the near future. Unfortunately, though, it only works in one direction. Research has shown that heart attacks were preceded by erectile dysfunction in a significant number of cases. However, there was no significant probability for erectile dysfunction being followed by a heart attack. So, in hindsight, one is always wiser. Another dangerous condition that goes along with erectile dysfunction is sleep apnea. If you are a middle-aged man and overweight, chances are high that you stop breathing periodically in your sleep. Since you are asleep and don't wake up completely when this happens, you wouldn't know if you did. Usually it's the partners who wake up because the man lying next to them stopped breathing, which scares the hell out of them because they think he might be dead. Daytime sleepiness and microsleep are symptoms which are very suggestive of sleep apnea. This condition has to be diagnosed and treated immediately because it poses a serious threat to the cardiovascular system. People with sleep apnea carry a 30% elevated risk for dying or having a heart attack. The diagnosis of sleep apnea is easily done overnight with a recorder monitoring your sleep. The third common health problem leading to erectile dysfunction I want to mention in this video is thyroid disorder. The thyroid is a butterfly-like gland located at the base of your neck and produces hormones which are vital for the metabolism of the body. Both over- and underactivity of the thyroid gland are associated with erectile problems. Therefore, doctors need to have these conditions in mind when assessing erectile problems, which means a patient complaining about ED should be tested. I often send patients to the cardiologist just to rule out any critical issues with the cardiovascular system. I have a little machine they take home with them to test for sleep apnea, and I measure thyroid function in the blood. So all of this is straightforward stuff and not very embarrassing, right? I hope this video helps you to look for help if you suffer from ED. Just go to your doctor and get checked. Nothing to be afraid of. Thanks for watching. Bye-bye.